Today I wanted to talk about an important meeting that was held here at the Indiana General Assembly by the Legislative Council. Now, the Legislative Council is actually various members of the General Assembly, basically the leadership team from all four caucuses. At this time of the year, we meet to decide what will be the exact topics that are discussed over the summer in the interim study committees. This year, by the way, we had, I think, a record number of suggested topics. So the process works in sort of the following fashion. The four leaders of the caucuses meet to preliminarily go over every request that was made and sort of come to a consensus on the various topics which should proceed further, and that can be, of course, a matter of some debate. There were some topics that I thought should go forward which didn't survive the cut, and I think each of the leaders had a similar type of an experience. But in the end, we come up with a number of important issues that we think need to be studied by the various interim study committees. The first deals with the various problems that you may have been hearing about regarding the administration of the ISTEP test in our public schools or in the schools in the state of Indiana. And as you might remember, unfortunately, there were various problems in the actual administration with the system breaking down, the children not being able to take the test on various days due to computer glitches, technical glitches. And the problem that I think all of the members of the Legislative Council recognize there is that we now have so much riding on the ISTEP test that we just can't afford to have those type of problems. So there is a study committee, the Education Study Committee, which will be asked to, at their very first meeting, hold an important all-day meeting on the issue of what happened with these problems in the administration of the ISTEP test. The next one I'm going to mention is, of course, the implementation of the Affordable Care Act. Some of us in the Indiana General Assembly have been very concerned that we have lagged behind as a state in reaching out to the federal government for the implementation of that important health care coverage for our citizens. It's estimated that maybe as many as 300,000 additional people in the state of Indiana could be covered by the benefits of the Affordable Care Act, but we've really got to pursue this and get the details worked out with the federal government. So there is a health committee, the Health Finance Committee, which will be tasked with looking at a couple of very important issues involving the Affordable Care Act, the implementation of the insurance exchanges to help consumers actually get the coverage underneath the Act. Also, there will be other issues, of course, that will naturally be brought into the discussion there. We're hoping that it'll lead, of course, to an overall look at where is Indiana at right now, where is the governor's office at in terms of actually fulfilling its duty to make sure that this act is implemented in the state of Indiana. You'll be able to hopefully continue to follow the important work that these committees will do over the summer. There's nothing official in terms of a bill that gets passed out of these committees, of course, but they do study and make important findings and recommendations to the Indiana General Assembly when we come back next year.